Well, hey everyone, this is Keith with Positively Osceola here at John 316 Cafe, right in New York Avenue in downtown St. Cloud. Moved over a little bit, so if you've been looking for the cafe, hasn't gone out of downtown. It's just a little bit over towards 13th Street. But today we are so honored to be able to have Dr. Prakrut Patel with Orlando Health St. Cloud Hospital. And today we're going to talk about the Orlando Health St. Cloud Hospital's new STEMI program and cardiac catheterization lab. So welcome.
Thank you for having me here, Keith.
You're a busy man, so thanks for coming to see us today and talk. Hopefully what we talk about today is something that we can really understand and the importance of what that means to the St. Cloud community. So first of all, let's just kind of talk about the overview here and talk about what this means to the St. Cloud and Osceola County community to have this right in St. Cloud, if you would, please.
Sure. So first of all, I want to explain to you what STEMI means. STEMI means a major heart attack. It happens when one of the major arteries of the heart gets clogged off. Right. And it can present in several different ways. Old school, we always hear people having elephant sitting on the chest-like sensation. That's a classical presentation, but there are several other different ways people present when they have a major heart attack. Sometimes people just have indigestion, severe form of indigestion that does not get better. Sometimes people have jaw or shoulder pain that does not get better. At times people just have shortness of breath and profuse sweating. So these are several different ways people can potentially present to the hospital when they're having a heart attack. And what we have done so far with the help of our hospital organization is we have created a heart cath lab 24/7 program that allows us to take care of patients who are having major heart attack right away. When they arrive to the hospital, we can take care of them.
So a lot of dinging going on, proving that we are absolutely in a coffee house today. It's great. We're just, honestly, people ask us a lot, why are we out in the community and not in the locations where the expert is? Well, I think that's probably part of the emphasis that we are in the community, trying to make it available to people to understand the importance of this. So, I think you talked about the symptoms, and I think that sometimes that's an issue we talked about this earlier. I think it's hard to know. You say, I'm having pressure on my chest. I don't feel right. And so what do you say to people about that? Because I know I try to search out myself and say, gosh, would I just take those symptoms seriously and get myself to the hospital? Do you find people are just trying to make sure it's a real symptom before they come see you?
If someone has symptoms that we described of for 15 minutes or longer, they should check into the hospital just to see what it is. It may not be anything. If there is nothing going on, they'll still be discharged. But if they are having a heart attack, these symptoms should not be ignored because the penalty is very huge.
Yeah, certainly. And so I know you often talk about how important time is, and the golden 90 minutes. Time is of the essence, correct? So yes, explain that to us a little bit, how that is something we need to know is vitally important.
See, when the artery of a heart is occluded, the heart muscles do not get enough blood. And if you wait for too long, more than 90 minutes or longer duration, the heart muscle start forming scars. And they become non-viable, and you start losing heart function. Earlier you come to the hospital, sooner we open the artery, the better chance the person has to keep the heart muscles viable. So the time is of the essence, and in order to prevent any delays, we open 24/7. When a patient arrives to our hospital when they're having a heart attack, they do expect us to be there within 30 minutes. And once they arrive to the hospital, our whole team, it's me and 4 other people, they arrive within 30 minutes. We move them to the heart cath lab, and we open up the artery, typically within less than 60 minutes. So time is really of the essence to save the muscles as much as we can.
Right, and so that is a big thing for our EMS individuals, correct? St. Cloud, Osceola County. So is that going to be a possibility for them now to come right to St. Cloud? Because as we all know, traffic is not always cooperative in the area. So that's got to be a big play for you as well, right, for people's lives.
Yes, sir, absolutely. As of not today, but until about last week, all the patients who showed up to St. Cloud Hospital are from this area when they had a major heart attack were transferred outside of St. Cloud because we did not have any facility capable of taking care of them when they had a major heart attack. But from now onwards, the ambulances are already aware of us being capable of taking care of those patients in St. Cloud. And they notify us 10 minutes ahead of time, even before they bring the patient in.
Right.
So our ER doctors are notified up front.
So how did you get involved with this particular field? Because whenever I ask somebody that from Orlando Health St. Cloud Hospital, it's always great to hear the passion and the commitment from that provider. So tell us, how did you get involved with this portion of healthcare?
So personally, I got involved with interventional cardiology, which is a subspecialty of cardiology,
Right.
because I saw immediate results. Someone comes with any major heart attack, and we take care of them, make them feel better within less than an hour and a half. That's immediate result, and you cannot beat that feeling. Plus, the satisfaction we get from seeing the relief on the family members' faces, it's just unbeatable.
So if there was one thing you wanted to say to the community today, St. Cloud community, Osceola County, what would be that one thing you'd want them to take away from this conversation?
I want them to know that we're available for you. You do not need to go too far. Let's not waste any time. When you're having a life-threatening emergency, come to this hospital, call the EMS. That's the best way and the
Right.
safest way to arrive to the hospital. We will take care of you. And at times, if there is any physical condition that cannot be treated with a stent or the modalities where we are able to offer here in St. Cloud, we also have backup available. If they need an open heart surgery, we are able to arrange for those treatment plans as well.
You know, I've lived in this part of the county for over 37 years now, which is crazy. But just speaking from my family perspective, I love to see how much Orlando Health St. Cloud Hospital is committed to bringing in the best providers, the best technological facilities. It's been amazing to see how rapidly the hospital has grown in so many ways. And it's just so important because, you know, as the community has grown, and I always say, you know, the secret's out. This is a great place to live, work, and play. And that live part is very much about how organizations like Orlando Health are able to provide the best in care and bring in such great physicians. So we appreciate you today very much to come in and talk to us. And
Thank you for having me.
you know, it's a big deal. It's been an honor to see the inside of the facility, and then a greater honor to be able to talk to the providers and know that the best care in the world is right in St. Cloud.
We are part of Orlando Health Heart and Vascular Institute, and we provide coverage and services across 4 different counties in Orlando.
Awesome. Well, you guys are doing a great job, and again, we really appreciate you very much.
My pleasure. Thanks for having me here, Keith.
Honor. Hope we can do it again very soon.
Yes, sir.
All right, again, well, folks, this is Keith with Positively Osceola, another one of our Coffee Talk Lives, but not just another one. This one is about health and life, and of course, anytime we get to speak to Orlando Health St. Cloud Hospital, it is an honor, and so we appreciate it. Don't take it lightly. Again, Keith with Positively Osceola, along with Dr. P.K. Patel, Interventional Cardiologist at Orlando Health St. Cloud Hospital, together making a positive difference in and around Osceola County.